So I want to start with just talking about this shift that we're really talking through today. The focus just on resident well-being and really looking at data in a way that we haven't looked at it before outside of the EHR. Kelly, why don't you kind of kick us off? Talk about what it means to be experiencing a shift towards resident well-being.
Yeah, so I teased this a little bit in my earlier panel where I talked about, 80% of the things that drive health outcomes for seniors, or for anybody really, are these non-clinical factors. And the challenge is that a lot of those things are observations and just, behaviors, environmental things that aren't recorded anywhere. So we are in a real situation where we need to, in order to get in front of some of these clinical things, we need to find really creative ways that we can look at the data that we do have available and start to analyze that and start to take action on some of those things, those preclinical things that can lead to better outcomes. And that's why I've been loving working with you guys at Accushield, because I think that a lot of the information that we're going to talk about here with Project Love Meter is exactly that type of data. Mm-hmm. This is stuff that's captured just through visits by healthcare providers, by third parties, by friends and family and other folks. And we can look at that data and understand if somebody's potentially feeling a little lonely or disconnected, and start to take action on those things. So this is a really exciting time to be doing things like this and thinking about what are those non-clinical factors we can look at.
Yeah, great points. And we're loving working with you guys because I think it really challenges Accushield. And as Alan Barnes mentioned earlier today, it's not that easy, I think, to see how something like a visitor management solution fits into value-based care. But as we're growing with our relationship with you and with Bickford and our other customers, we're really finding that challenging how we use our data, or again, data that we may not be using today, is really having significant impact on resident outcomes. And so we'll talk a little bit about that. How many of you are Accushield customers, just by raise of hand? Okay, and how many of you, but also by raise of hand, use visitor data? And so visitors from family, volunteers, third-party caregivers, how many of you use that today when it comes to resident outcomes? Okay. So, Stephanie, I want to ask you this next question. You guys have been using Accushield for a while now. Did you ever consider using visitor data before you guys started using the system when it comes to resident care?
No. So I'm at the regional level, and we track a lot of things, but that just wasn't one of them.
Yeah, and so again, as a former operator, I used paper sign-in books.
For sure.
And if at all. And so how the heck can you use that information to impact resident quality of life? Let's talk about so you're a boots out on the floor.
I am.
You want to be out there because you like supporting your team as much as possible. So yeah. Having you here, I think, having experienced implementation, having been through the higher path meeting, using Accushield data is really important. So far, since using the system, how are you guys integrating visitor data into the higher path meeting?
So we can identify, our residents that don't get family participation as much as you would assume. We have families that live out of state. We can identify if their home health is actually coming in to service the residents, things like that. We can see if they're having visitors, if they're not having visitors, that it played a huge part in just identifying that.
Yeah, that makes sense. And Kelly, can you add to that? So how do you see visitor data, and let's set aside the social aspect and just focus on third-party care visits and anything besides Love Meter for now. How does that fit into the value-based care puzzle?
Well, again, I think one of the things that we know that we need to do with value-based care is do some serious care coordination. And an important factor of that is this isn't care coordination amongst people who are in your community and employees of your community. This is anybody who is a stakeholder around the resident. And so it's really important to be able to ensure that your PCP, therapies, home health, hospice, other third parties are also at the table. And we also want to make sure that you and your residents are getting the value out of those relationships as well. And so it's really interesting, some of the data that we can capture, even including, a home health person comes into the community and spends, 5 minutes there with a resident. We know that that visit was not a worthwhile visit, unless for some reason the resident was gone. And so I think that it's really nice for us to be able to get that data to have conversations about how we can have more meaningful relationships with those third parties, and also ensure that we're bringing them to the table to be part of that care coordination meeting and have all the appropriate stakeholders at the table.
Yeah, great point. And one of the things I know you guys did at Bickford, Stephanie, and that's, we talk a lot about, at least at Accushield, about the sign-in process, but there's a lot of valuable data that can be captured at the sign-out process. One of the things I know you guys implemented was really centered around trying to reduce avoidable falls. Raise your hand if that's important to you. Didn't get as many jokes as I thought I would. But we sat down and we said, how can we help you? You've already got programs in place, but how can a visitor management solution help you identify potential fall hazards? And so do you want to talk to us a little bit about how we did that?
So when we talk about residents that may be self-isolating, not, in the midst of the goings on in the branch, activities, just the identifying need of a resident. When residents are in their apartments and, if they're alert and oriented and they're not coming to meals because they choose not to,
right.
Well, we kind of see how that impacts the resident.
Absolutely. And you guys actually added a question to your sign-out process for providers.
Yes, that was, did you see any risks for our resident today? Did you note them to have a fall risk? Did you note them to be unstable or maybe confused, maybe dehydrated, if you will? If you noticed that they wouldn't take a drink for you after a process of PT or OT or a speech session, they didn't want to do it. The question would be, were there any notable concerns? And if they put yes, then it would immediately alert the nursing team to address it.
So that's amazing. But my immediate thought is, how am I going to convince a third-party caregiver to use a system like this? What was your experience as far as getting pushback and maybe how you responded to it?
Oh, no pushback.
None.
That's the standard.
Good. Yeah.
If Bickford introduces something to the branch, it is our responsibility to adhere to that and educate everybody on what we do at Bickford. So
Perfect.
I feel like we've had, I don't know the exact stat, you're going to have to tell me that, but it's pretty up there because that's the standard.
Yeah, so I wrote it down, and this is just a 90-day period. And when I read these numbers to you, I want you just to think about, we've talked about data a lot today, but the number of data points we could be including in conversations. And you said earlier, Kelly, don't be afraid of it. It already exists, so why not digitize it and really make it make sense? But at 3 of your branches, in a 90-day period, they captured over 10,000 visitors signing in and signing out, over 3,000 third-party caregiver sign-ins. They captured about 70 tours, and what I love about that is those unplanned tours, those walk-ins, you guys get to know right away when they're there. And the big piece, though, I want to talk to you about with the data you guys have collected is all around Project Love Meter. So there's an internal joke at Accushield. We have a report called Love Meter. The joke is that it's a dating report. It matches residents with residents. Yeah. All joking aside, coming from skilled nursing, social isolation for me is always a tearjerker. Just knowing the number of residents in our industry that don't get, the number of residents in our industry that just don't get visitors, sure. And the strain that it has on our staff is really tough. So we asked ourselves, sorry, we asked ourselves, how can we help our customers not just identify those residents that don't get visitors, but also respond to it? And so we've done that with Bickford, and I'd love for you to share with us just kind of how that journey has gone, especially, you know, how you're using the data point during the higher path meeting, how that's been going.
So with our higher path, with the residents that we identify as having a need, we IDS them in our higher path meetings. And in our meetings, there is clinicians, be it the nurse practitioners, sometimes the doctor, the clinical nurse from Curana. And, you know, we've been able to see a decrease in antipsychotics that we're using for our residents, and them participating more, family participating more, not just with that specific resident, but as a whole in our branches, maybe volunteering more, just seeing just the other side of the care that the partner that comes in that is matched with our residents is giving them.
That's good to hear. And Kelly, what I want to talk to you about a little bit is, so with our Love Meter report today, again, it's tracking and trending all the social visits. And when I say social visits, it's truly family, friends, and volunteers. We've talked about how we capture third-party care providers, but as you know, they're not there to make a social connection, they're there to provide a service. So that's kind of excluded from our Love Meter report. The data point allows us to track and trend the frequency of social visits. How does that data point fit into value-based care?
So, you know, again, we want to think about all of those precursors that lead to clinical adverse outcomes or other adverse outcomes. When we think about COVID, right? We've talked about COVID a few times here, and we think about one of the worst things that happened during COVID was that we had residents who were isolated, who were lonely. You know, we saw muscle wasting occur within 2 weeks. We saw falls increase by more than 5 times. And we know that a lot of that was simply due to the fact that residents were stuck in their apartments and didn't have that interaction with other people, not just on a clinical level, but on a social level as well. And so that's what is really important to me about this work, is that we know that this is a data point that we can very easily get to, that the work that I'm doing is starting to pull this data from Accushield and then be able to aggregate it again behind the scenes of this higher path technology that we've been talking about. This higher path meeting is our coordination of care meeting. Higher path technology supports that. But being able to pull that and then help to auto prioritize these residents that we're going to talk about during the meeting. You know, when we talked about earlier, the risk was having some of this data, but by auto prioritizing it and then spoon feeding it to the people in the meeting allows you to not have to look 25 different places to get the information. We can kind of spoon feed it all in one spot. So watching Stephanie and her team using this data today and seeing how impactful it already has been in terms of getting ahead of some of those things that might be problems down the road has been just mind-blowing to see in action.
Yeah, I think the caregivers at Bickford, they are as invested as we are with the care of the residents.
Yeah.
We're all just caregivers.
Absolutely. I've had the pleasure of sitting in on several of your higher path meetings, and aside from the process just making sense, seeing the support that you guys have behind it it really makes a big difference. So we've talked about the data point. Let's talk about the response to identifying those at-risk residents. And I'll start this by saying we realize that not every resident's appropriate for social visits, but this data point allows you to evaluate those at-risk residents, have the conversation, are they attending activities? Are they leaving their room for meals? What are the other things that are impacting loneliness and isolation for these residents? If they're appropriate for visits, but the family simply can't come, and we know that happens a lot, our system now has what's called volunteer coordination. Raise your hand if you use volunteers in your buildings. So I call them an extension of my workforce because that's truly what they can be, but it's tough to get them. And so really excited to announce that we are launching a nonprofit to help find volunteers for our customers. Yay. But with this nonprofit, we're going to tap into about 1.6 million volunteers that we have in our network. We also recruit from universities and churches, but what makes it special is we're using about 70 different data points to match at-risk residents with volunteers. And so can you share with us, Stephanie, how that's impacted resident quality of life?
Well, I think that it's impacted them greatly. You know, those residents are now, we've horned in on what is their why, and now some of those residents are actually, if it's bird watching and she is given a whole speech on bird watching, that's her why, and she's getting fulfillment out of that, where before she was sitting in her room watching it on TV alone. And I think that when we report that back to the families about what's happening with their loved ones, they're beyond grateful. The family's happy, the residents are happy. Lord knows the nurses are happy because there's no interventions that could lead to something else. These BFMs, we call them Bickford family members, they're happy because the residents are happy. You know, the happiness coordinator plays a big part in our branches with the love meter, and we've had an influx. The number is high. You got to tell me with the increased volunteers in our branches.
Yeah, so I actually didn't write that number down, but the number that I did write down is the reduction in loneliness risk. Yes, and so do you want to talk about that a little bit?
The reduction is 63% for our residents in the 3 branches that Project Love Meter services for Bickford Senior Living.
Yeah, it's huge. But you know, again, going back, we helped reduce that loneliness risk just by increasing social connection, just with the visits that we did. But remember, if you think about, you know, if you identified Mrs. Smith who's not getting visitors, she's showing up on the Love Meter report, maybe she's not appropriate for volunteers, but we can increase activities, we can increase other things. So it really just gives you that proactive approach that you like to talk about, Kelly.
Yeah, agreed.
So our time is up. I wanted to just see if you guys had anything left that you wanted to add. We'll start with you, Kelly.
I want to say that this is also personal for me. I just moved my dad from one memory care into actually an assisted living as part of Bickford. They were full before, otherwise I would have moved them right there to begin with. But you know, it's interesting as a daughter, you know, the organization he was with were using Accushield, and then the last time when I went there to move him out, they'd actually stopped using it, and I have to say I was glad I was moving him out, because I rely on Accushield to be something that helps me ensure that my dad is safe. My dad has aphasia. He can't tell me who's coming and going or whoever in his room or in the building. And so knowing that that's there is something that's really important to me. And you know, only being able to visit him on the weekends, he's several hours away. You know, having those types of things in place and knowing that he can potentially be matched with somebody as well is really important to me.
Sure.
Thank you. How about you?
I think that everything that we implement, my first question is always, is this good enough for my mom? And with all of the partnerships that we have, I make it a personal choice to be intentional and to form relationships, because it very well could be my mom.
Absolutely. And I'll just end with, you know, it's tough to think about using visitor data when it comes to value-based care. I challenge all of you today, you know, if you're a 3 still or a 4, and we're working on a 5, hopefully you're a 5 after this, but think about leaning into things that might seem unusual or uncomfortable. Think about the way we don't use the data we're collecting today. And then again, and this is kind of a common theme, rely on your vendors to help you figure that out, to use that data. So thank you guys for joining me today. And thank all of you.